No, this office is really well put together and well run.
Has it been relatively efficient from start to finish?
Oh, yes, yes, yeah.
And are there things that I can do better? I mean, I'm open to that too. Areas that we can work on?
Not that I can think of, unless you can make this happen without any kind of drug or any kind of
magic?
Magic, yes. If you can,
if I can wave
magic with, yeah. And you have that about you. You can be magical. It's been magical for me.
I mean, how did you overcome the fear of kind of tackling this?
Well, I've been insulin dependent for so many years that shots are nothing to me. I mean, and once you realize how easy it is and not painful, if I hadn't been so comfortable with injections and the ease of it, it may have been different, but I don't think so, because even if someone isn't, it doesn't take long to get good at it, and the benefit far exceeds the work to get to it, far exceeds it.
So there must have been a period of time where you guys weren't intimate.
Yes.
And what was it like that first time when you were doing a penile injection?
Oh, it was like a new day. It was like a new day. You know, I mean, she's been so patient, so understanding.
That's really neat.
She knows that diabetes causes problems, and once I told her that, she went, okay, well, that's part of life. So she was able to accept it, and we, like I said earlier, we were really sexual when we were younger, and to have some of that back now is tremendous. It's fun. It's not every day like it was, 30 years ago, but
you guys are working. And
yeah, we work a lot, and it's tremendous. It's really fun. It's fun again. That's what it is. So I don't like starting something with her and not being able to finish it, and that was what was going on enough for me to become concerned enough to talk to somebody about it. And you make it really comfortable. You make it really easy, and that's important. That's really important.
Are there downsides to the penile injections? Like, from your perspective, or you think another man's perspective, or?
If another man was wanting to have sex way more often than I do, from what I remember, you were saying 3 times a week, or the pamphlets were saying 3 times a week about that maximum, which I've only achieved once or twice since starting it.
Nice though.
Yeah. And we'll go on vacation. Like I said, we're going to go to Hawaii in the spring, and I'm sure we'll have 10 days of plenty of time to do that. But if someone's used to more often, they may have an issue. But I don't see how they could be used to more often if they're not getting it up now at all. So,
right. So something is a lot more than nothing.
Correct.
And I guess if a guy's trying to go several times a day,
those days are long gone for me. I remember it. It was fun. But yeah.
Do you feel like you guys are closer because of the technology, the medicines, and so forth? Like, has it added your relationship to a new level?
No.
It sounds like you guys have been close.
We're close. We're very, very close. It's just an enhancement, but it doesn't change our relationship at all. We still laugh every day with each other. We feel that's very important. And it's not like we try and do it. We're just funny with each other. And levity there's very little that can be as good for you as levity.
And did you feel the penile injections was safe? Did you ever have any concern that it might not be safe?
I probably did when I was reading the pamphlets before I spoke with you, but you made it clear that it is. And, there's a few places that you don't inject, and it's easy to see. The pamphlets, your instruction, everything's fine. I don't believe it unsafe. If it's going to be unsafe, it's going to be your own fault. Either you did something wrong, you're using a needle over, or you're not cleaning the area. I don't know.
Right.
But if it's done properly, it's just been nothing but great.
And has the process been simple?
Yes.
Working on getting the medications and the whole.
No, it's been easy. It's been easy. There's a company that mixes the product and sends it right out. Everything is smooth and easy.
And did you have any issues with titrating it, or
I'm
you just kind of figured out the right dose?
Oh.
How did you kind of go through that process of figuring out the right dose?
Well, you made it really clear that you can't overdo this. and that you have to be careful on your dosage. So we started out low. So I'm going to say the first time or two, it showed me what it could do. It didn't do what I wanted it to do until I got the dosage correct. And now, I mean, there's no way that I'm going to have an injection, a hard-on for 4 hours that I have to go to a hospital. I could see how it's possible, but that won't happen to me.
Yeah.